Hello everyone, this is Dr. Ade of Jerry Doc Limited. As usual, how is mom and dad? Our regards to them. So thanks so much for your comments and your questions regarding our earlier topic, cancer. Someone specifically asked, Doctor, can you talk about prostate cancer? I need to know the signs of prostate cancer. And I promised to do that, and here we are. So, what is prostate cancer? Basically, it's malignancy of the prostate, and it's the most common cause of malignancy that occurs in our men. So we need to know about it. As a man gets older, the prostate enlarges in most men and does not usually lead to cancer. In this case, it's known as the benign prostatic hypertrophy. It's just swollen prostate with no cancerous cells. It's just swollen. So in this case, what happens is that it compresses the urethra, which is the pipe by which urine flows out, and leads to symptoms such as increased frequency of going to the loo, a feeling of incomplete emptying of the bladder. So they go to the loo eventually and but they feel that something is still there, and there might be urgency, like they feel that they have to go right now. So they have some little accidents, dribbling on themselves, soiling themselves because of the compression of the urethra by the enlarged prostate. Now I've just explained benign prostatic hypertrophy. Okay, we've got something in that prostate known as the prostate specific antigen, which in most cases, even in the benign prostatic hypertrophy, might be elevated, but the prostate might not contain any cancerous cells. So I will encourage every man to kindly check as soon as you hit that age 40. Just know the normal for you. Usually between 0 to 2 at that age. If it's above 2 at age 40, you need to actively monitor yourself. If you're above 50 years old and the prostate specific antigen is above 3, you need to 3 nanogram per DL. You need to monitor yourself. And when you're 60 years old, if the prostate specific antigen is above 4 nanogram per DL, then you need to see your surgeon. To keep it simple. Now, what happens if you notice some signs? Now, I won't tell you that there's a specific sign of prostate cancer that you can pick out, apart from the signs we've spoken about in the past, like the weight loss, the easy fatigability, and the others. Part of what you might experience is what I just explained earlier, like the urinary urgency, the incomplete emptying of the bladder, and the increased frequency to the loo. Then this would now be in addition to the initial cancer symptoms like the weight loss, easy fatigability, and others. So I wouldn't tell you that there's a specific sign that you can, touch and pick. Usually when you go to the hospital and they check your prostate specific antigen, if it's elevated, the doctor might examine you through your back passage to examine the feel of the prostate, because we doctors know how a normal prostate should feel like. If yours is hard or shrunken, then we might have to take it a step further by taking a little bit of the tissue. We examine it under our microscope to see if there's any cancerous cells in there, and also to stage it and to grade how aggressive it is. Now, depending on your surgeon, you can either go for a surgery or a radiotherapy or a brachytherapy. Now, I don't want to bore you with what happens after. I just want to talk about the signs. So let's recap it. In some men, we've got the benign prostate hypertrophy, which is just the prostate getting swollen as a result of old age, and this leads to compression of the urethra and eventually leads to urinary urgency, frequency, and incomplete emptying of the bladder. Now, in some cases, not in all cases. This might lead to prostate cancer when the PSA gets severely elevated, and then we've got all the symptoms accompanying it, like we said in the earlier video. If you have not watched the earlier video, kindly do, and acquaint yourself with all this information. For more information, for questions, for clarification, drop your message below and I'll be here to do justice to it. I hope I didn't make things more complex. Yeah, thanks so much for spending your time with us, and kindly register mom and dad for our care on joy.org.uk, and also subscribe to our channel. Yeah, thanks so much. Bye.